And hello, everybody. I hope the exercise has sparked some reflections and interest for the discussion that we're about to have. So let me just briefly give you an outline of the segment of the program that will follow. We'll begin with a presentation of the policy brief by Ms. Rachel Firestone on behalf of the Hub's Working Group for AI and Global Health. Then we'll have the panel discussion, and we'll have a handover of the policy brief on behalf of the working group to the Ministry of Health. And finally, we'll hand in to Dr. Katja Polman for her closing remarks of this section. So you can find the full bios of all the speakers and panelists in the booklet that the Hub has very nicely put together. But to save time, I'll just briefly introduce our panelists and our speakers with their name and their title and affiliation as they join us on the stage. So I'd like to start by welcoming Dr. Arash Rashidian, head of the Science, Innovation, and Data for Impact at the WHO EMRO, and also a professor of health policy at the University of Washington. And you're welcome to welcome them to the stage as they come. Then I'd like to invite Mr. Bernd Fiedler, Senior Director for Government Affairs at Siemens Healthineers. I'd like to next welcome Dr. Jana Fehr, health researcher at Berlin Institute of Health at Charité. And last but not least, Ms. Rachel Firestone, representative of the Hub's Working Group on AI and Global Health and a consultant for digital health. And I would like to pass on the stage to you for the policy brief presentation.
And I have this dangerous clicker that I'm afraid to press too soon. So here we go. All right. So we just saw one compelling example of health AI's opportunities and risks. And the Global Health Hub Germany's annual theme, as we already discussed, is for this year, this cycle, this 2025-2026 cycle, has been exploring exactly this tension between the two. And so the annual themes working group spent the year diving into some of these issues. And as part of that, we looked at examples of how AI tools are already being used in deployment today across different clinical contexts. And thanks to the group's deep and diverse expertise, the result is a policy brief backed by evidence-based analysis that offers targeted, time-sensitive governance actions to address these big questions, and which we think are key to keeping AI use in healthcare and public health responsible and worth our trust. And we're going to talk about trust a lot here. It's exciting that it has already been a term that's been used a lot today. So why is this important? This is not to say that what the brief offers is a single answer, an answer to all of our questions, a magic solution. It's not. But it does use a particular inflection point, which is the EU AI Act coming into force, as an opportunity to have impact and to shape how AI for health will be governed in real time. And the aim is to use this regulatory commitment to discuss certain critical AI governance needs in Germany's health system and in international health contexts. So what the policy brief tries to do is look closely at what compliance means under the AI Act and compare that to less legally codified, but very substantially discussed concepts of trustworthiness, and to offer concrete steps that we think are necessary to build a public oversight infrastructure that will bring and keep health AI deployment that is really trustworthy. So how do we do that? The brief draws on evidence from 2 health AI deployments in high-income clinical contexts to look at where legal compliance and trustworthy implementation overlap and where there are gaps. And the group looked at a lot more case studies than what made it into the brief. These were 2 that we thought were really reflective and also reflected the sentiments and the work of some of our main host communities, women's health and mental health, but we did look at more. And we look at a breast cancer screening case in Germany and a mental health triage case in the United Kingdom. And as we do that, we apply the Future AI Consensus Guidelines as the primary analytical lens for evaluating the case studies. For those who, in case you're not familiar, the guidelines are actually based around 6 principles using the future mnemonic, and they were developed through a consortium of 117 interdisciplinary experts from 50 countries, and it was formally vetted and published by the BMJ, or British Medical Journal, a top 4 medical journal. And then on top of that, the brief also uses the WHO guidelines on ethical use of AI in health and preeminent principles of biomedical ethics to ground the piece. And the future AI guidelines, I forgot to mention, are specifically developed for health AI and health AI deployment. So though the case studies are quite different in purpose and design, the analysis showcases implementation lessons that are cross-cutting and become even more important when AI tools are adapted or transferred across contexts. And so 3 significant patterns emerge. 1, evidence generation remains heavily dependent on developers, AI developers. And number 2, development is occurring faster than governance infrastructure. No big surprise there. And so we need a structure that is built to adapt with new tech development over time. And then the EU AI Act establishes legality, which is very important, but not necessarily the how to ensure trustworthiness in practice. And so, for example, the Act gives us important legal baselines requiring risk management, technical documentation, human oversight, conformity assessments, but not yet a governance infrastructure that offers a mechanism to standardize ongoing performance demonstration or communication to users or affected populations. And so across both case studies, important governance challenges persist despite behavior that would be in compliance with today's legal requirements. And so we want to look at that gap, and the working group through this policy brief offers building blocks for a structure that would help sustainably implement the EU AI Act for health overall, and also focus on where the Act is weak from a trust perspective, which is especially regarding independent validation, meaningful transparency, and publicly facing long-term performance monitoring. So here are the recommendations. We have recommendations that look at Germany's domestic health system and also relate to its role internationally. And I'm going to talk about the domestic governance recommendations first. But for the international side, in the spirit of what has been talked about in the last 2 days, we really talk about Germany's role as a building support, as an honest broker, as a humble broker for international health, public health, and health security. And then Germany's role in what we can call an international health AI marketplace, as an entity that imports AI tools and also shares and exports tools to other countries. So I'll go as briefly as I can, because we have limited time, and there's more for you to read in the brief itself. But the first recommendation is to set standards for AI disclosure to patients. The Act, the AI Act, establishes transparency obligations between developers and deployers, or the users of AI. So in healthcare, that would be clinicians, health insurers, hospitals. And it provides limited guidance on what that means for downstream communication, including disclosure to patients. And for the second recommendation, there's a lot packed in there, as you'll see in the brief, so I'll go into a little bit more detail. But we recommend building a national health AI registry and evidence infrastructure. And the reason why is because at present, we don't have a comprehensive infrastructure in Germany to systematically track deployment, monitor outcomes, or support independent evaluation of health AI systems. And at the same time, effective governance depends on knowing which AI systems are being used, where, how they perform, and whether evidence supporting their use remains valid over time. And so a national registry, in the absence of an EU-wide registry, which would be great, highly recommended, a registry and also open reporting requirements would help do this by transforming the currently fragmented black box of local deployment, different things happening in different places. We don't necessarily know what and where, aside that it was approved at one point. that would be transformed into a single auditable public resource. And there are other actions that would go hand in hand with that you'll see in the brief. And then very briefly, recommendation 3 is linking public funding and reimbursement to trustworthy AI practices. So meaning including some of what we just talked about and requiring prospective protocol registration, independent fairness analyses into Germany's funding, evaluation, and reimbursement pathways. And these could be integrated into existing systems to avoid creating parallel pathways. So, for example, existing HTA, existing reimbursement, and funding processes such as the AMNOG regulation for pharmaceuticals, rather than reinventing yet another wheel. And for the international side, in the spirit of what would be done at home, advancing quality standards for international health AI deployment. And this really applies to Germany's role in terms of international norm setting. Today, there's no widely adopted international mechanism that currently requires context-specific validation before health systems are deployed in new settings. And so the Ministry of Health could coordinate, for example, with the BMZ and collaborate to establish inclusive, fairness-based standards for international health AI deployment, including making published disaggregated performance data across demographic subgroups a condition for international evidence recognition. And this could be through WHO, bilateral partnerships, and development cooperation agreements. And then last but not least, establishing a responsible health AI export framework where health AI systems are increasingly deployed internationally, but similar to the previous comment, performance demonstrated in one place does not necessarily transfer. And Germany is well placed to leverage collaborative efforts at home and with partnerships internationally. So, for example, linking the BMG, BMZ, the Federal Ministry of Research, Technology, and Space, and others to produce a responsible export framework that would extend what Germany sees as important domestically to its international AI deployment. And I'll stop here. We've taken a look at the why through the simulation and some of the how and a bit of the what of these building blocks to help govern the double-edged sword of AI in health that we're bringing forward. And with that, I turn it back over to Dr. Karimian to take us through the panel. Thank you, Zahra.
Thank you very much, Rachel. Thank you for that informative presentation and summarizing the policy brief. And so, if I may go ahead to the panelists and start with you, Arash. I would like to ask you, as AI use becomes more common in healthcare, and many countries still face gaps in basic infrastructure, equipment, and digital capacity that is needed to use it effectively, we have certain regions like EMRO, where you have high-income countries and low-income countries that coexist and need to be served. What policies and approaches do you think are needed to ensure that AI helps expand access to healthcare and advance universal health coverage rather than widening existing inequity gaps?
Yeah. Many thanks indeed. Is it working?
I don't think so.
It's blinking. I was trying to read the meaning of the blinking. Probably battery is down. Yeah. It's not working.
This one
it's
is.
Not working.
Oh, sorry.
It's okay.
Oh, no.
Yeah. Working? Yeah. Okay. Excellent. Many thanks indeed. So, that's a very key question. I'm based in Cairo and responsibilities for 22 countries in the region. As you mentioned, there are high-income countries, middle-income countries, low-income countries, and emergency in several countries of the region. And that affects what you said. But the question is not just within that context. Can widen it up. Sort of when we think of different capacities, infrastructures, at the global level, comparing countries with each other. So the same question can be asked sort of as a general question from other contexts. Also within countries by certain conditions, as I mentioned it now. So first of all, obviously that's the point. So if a country doesn't have resources to have a data system that collects in a digitalized way, so that data is not visible and by default is not visible to AI development either. So then that's not presented well. But having a system itself also on its own is not adequate. So you might have a HIS system. Is it nationally connected? Is it talking to each other? Does it bring in everything with each other? And we see that there are countries that they are rich, and then you see digitalized technologies used in every setting, but the national data is not that well available. So then assume that the sort of the national data system is also there. The question becomes, is it good quality data? Mm-hmm. The data is well coded. I mean, sort of, we know in some high-income countries, they have national HIS systems that they link together, but they are using, for example, ICD-9 still. Mm-hmm. The coding is out of date, doesn't capture anything. Many systems globally, the data system, especially at hospital levels, and also in other settings, in primary care, are organized to facilitate payments, so for financing purposes. So let's say if a country is using DRGs for payment, and the data system have been summarized to make it less burdensome to the data entry process, then you don't have enough data to analyze the data system in that sense. So all those layers coming together, you may end up in a situation that part of the society is not well represented or is not well developed. So then any AI solution that has been trained on that data may not apply there. But then, in addition to all of that, is that and it was mentioned in Michael's example as well, who is developing the AI pack? And it was also part of so if you have a good data system, but the AI development is not in your context, doesn't matter how good you are. I mean, whether that data is, and we know that data on healthcare is a sovereign issue for almost every country, accessibility, concern for security. Even if you have all of those together, those become challenges. So, and if I translate this context to the issue, then obviously you may be less represented, but also maybe sort of less used in the process. Look at the example of, the skin mole. I think that was a very beautiful example presented. So if the sort of the data has been trained on a skin color tone, which is different to the context in which the app was developed, if the sort of the distribution of cancers, the skin cancers, is different from one context to the other, if the behavior of the society, if you take it in a society that has beaches and people go swimming to another society that doesn't have that, so the distribution of the type of cancer would vary. AI is also relying on the quality of technology that is using it. So if the scanner that is being used or the camera that takes the video, the quality is different. Add all of this if together, then you end up with a much bigger if. What is the dynamic behind the AI advice? So what has been the clinical guideline behind it? How it's coming forward and bringing those together? I'm not trying to complicate it, but that's the reality of life. So we were talking in that example, so I'm following the example to demonstrate the case. So that was an official ad hoc use of the process for apps. What if the system itself is using app unofficially? So let's say if a clinician also taking a photo, but on their device, there is an app that tries reading them. If the triage system, so in a way could actually result on further sort of exclusion of certain sorts of the society in decision-making, in decisions that may or may not be, it certainly is quicker, but doesn't necessarily mean that it's better for the outcome and result in that process. So the double sword question is a real, and this is actually, I would say, not the most difficult question we are asking from AI. These are straightforward, I would say, classical clinical questions. Make it a bit more complex, bring comorbidities into it, then let alone the clinical issue, go to public health questions, go to health policy questions. AI methodologies are being used extensively now for these purposes, while there are a lot of things lacking. I leave some of those to you warned us before the panel to not to talk for too long, so I'm going to stop. But some of those elements are actually become more complex, and the methodology is still not addressing those yet, and we need to be very careful for that. Yeah, thank you.
Thank you very much. I think you touched on a few factors, all of which were important, and one in particular comes to mind that I'd like to emphasize before going to Bernd because it's relevant, and that is your AI tools are only as good as the data that they were trained on. And it's not just about certain countries not having the infrastructure or equipment where they can use AI and then, of course, have their data train the model further, but also even within countries where they do have that infrastructure, as the example was shown, how many people will decline to have their data shared. And so that is a very important point, and I think it would be a wonderful segue to the next question that I'm going to ask from Bernd. Thank you very much. So Bernd, turning to you, the EU AI Act and other governance frameworks set important requirements for trustworthy AI. But in practice, there is often a gap between legal obligations and their implementation in healthcare settings. So from your perspective, working for Siemens Healthineers, what oversight mechanisms and incentives do you think are needed to ensure that AI tools are not just compliant on paper, but in reality, their use is actually safe, fair, and trustworthy? So when answering, perhaps you would consider representativeness of data, automation bias, and transparent reporting of risk and error, among other things. Please.
You should always be deeply suspicious for an industry official asking for a strict framework and oversight that is extensive. Because I'm working in government affairs for Siemens Healthineers, and with every new policy, there is, especially in the digital sphere, you can either try to avoid it, you can try to fight it, you can weaponize it. Let me explain. If compliance is a struggle, you can seal the market for innovation, which is for big established companies, talking like Facebook, talking like Amazon, can be a strategic path forward to not let competitors grow. On the one hand, you have cutting edge technology, which can be bold, which can be misleading, which can lead us to bias because of flawed data, because of what you just told us. On the other hand, you have a crippling multitude of compliance steps you have to take to be able to go to market, which with the AI Act that is spanning all the different topics, can be totally useful when you're thinking about, okay, I want to hire people and I want to assess people, and for that I need an AI screening, and those AI tools should not be overly discriminating, and they should be fair in everything. So, like, the risk of discrimination is way higher than the possible benefit of using that tool unregulated. So, absolutely, you should have those steps. When we come to the healthcare sector, there's another risk, like not using the AI and not using the more, hopefully more free time, the actual time with the patient that the doctor, that the medical professional has, is way bigger risk. So non-implementation is a risk. And you have, in the beginning of your question, you're asking about the different frameworks that are being set, and therein lies a problem. If you have a lean regulation where you say, okay, I have one agency, one notified body that I have to go to that looks into the machines, that looks into the AIs, into the model, and says, well, we have to see that it is compliant with this legislation and this legislation, like with all of that, and we go through the process together, and in the end, you can adapt and we can pass this, or you have to go back to a certain point. That can be fine. If you have to jump through several hoops with several bodies, and with each step you have the risk of all the money you put into the product already, into the development, that it can never, like, that it might drop off the edge there and never see the market. You will not have cutting edge technology, and you will maybe not find the bright AI powered future that you want to see. So it should be lean, should be there, and like we're having this discussion right now with the federal ministry, with the AI Act and the MDR, and like whether you want to have a sectoral approach or not, because right now we have regulation about software in medical devices. We also have legislation about artificial intelligence and about AI software. We at the moment we have to be compliant with both, and both are different with different terminologies, with different different things you have to comply with that are sometimes contradictory. So it makes it hard to go to market. And I think in this spectrum between cutting edge and dangerous and perfectly regulated or like harshly regulated and in a non-moving society, I think we can find a sweet spot.
I see. Am I on? Okay. Wonderful. Thank you for saying that. And I think one of the things that you pointed out that is that people can resonate with is once you have multiple frameworks, multiple regulatory bodies that all want to do their job, but they don't use the same terminology, or perhaps they don't even have their regulations or recommendations aligned in the same way, then it becomes very difficult to become compliant with all of them. But let me just quickly follow up on something with you, because you have the perspective of both government affairs and private sector. And I'm sure you know, many here would know, that some countries are just speeding right ahead with AI. And in Europe, Germany, of course, among them, does not want to fall behind. But then you have GDPR, and so you want to remain compliant there. We want research and development in the private sector to grow. We want it to not fall behind, but at the same time, we want to keep up with our standards. Where do you think, and I realize this is a difficult question, where do you think is a good balance for keeping with the two?
I think we can learn from other legislators. Right now in the European Union, we are not even able to roll out significant updates. Like we have when we have medical devices in the field and they have a certification, like they have been tested and proven and they're safe and sound and you can use them and they're actually helping cure patients. If you want to bring a major software upgrade, especially like when you trained a new AI model, then you have to think about that certification, because an update path, like we want to develop this device to be that good or to have that features in 20 years or in 15 years from now, because it has a life cycle. It's not there and then like next year it will replace. I mean, we're selling good stuff. Hospitals are invited to buy a new scanner every year or so. But in reality, they are there for 10 years. And of course, they need to be updated at some point. But can they be updated with a new software that makes them better, faster, better for the patients right here in the European Union? And that comes back to your question. We have to learn from other regulations. For example, in the US, there is an update path regulation where you can, when certifying your medical device, you can always say, okay, and we will want to develop in this direction, and this is then within the certificate, and you can actually stay cutting edge, new software on old hardware.
Perfect. Thank you for that. So, on to you, Jana. From your perspective as a researcher, what do you think are the most critical evidence gaps in understanding AI for health in real-world settings, and how do you think policy can help address these gaps?
Thank you for the question. So I think in the research field, we can observe a shift that the question is not longer anymore, what can AI actually do, but rather thinking of what happens if we deploy AI in healthcare systems over a long time at scale. And there are a lot of hypotheses out there, what benefits it can bring, but also which harms it may bring. And I think the biggest evidence gap currently lies that we don't know what of those is true. We see studies where we can see AI can perform so and has this and that diagnostic accuracy, but we know very little about, does it really improve patient outcomes? Does it really lead to reducing inequities in healthcare access? Or does it actually make them even worse? And I think this is where we need lots of research, and that it's something like a shift from foundational research to application research. What really happens if we deploy these systems? And also, I think we need to look not just at the performance level, but also what happens in the wider system. And I think what we really need is to establish more infrastructure to create testing centers. The EU is already investing heavily into creating testing centers across Europe, and I think it would also make sense to have this beyond European borders, because I want to pick up on the limitation that Professor Rashidian also mentioned, that the problem with AI is that it doesn't always perform in the same way when we apply it across different sites. And I think that's why we need to test it at many sites as we possibly can, not just within Europe, but also beyond, especially when we want to apply it in global health settings, for example. So yeah, I think that's where we need more testing infrastructure. And then it would also be important to not just do short-term studies on this, which is currently happening a lot, but to also think about how can we monitor the systems over time? What do we need for that? So that we can also look at the system level. What happens with the patients? What happens with healthcare systems? Does it really improve workflows? And I think this requires funding for long-term studies. And this also requires standardized frameworks, like how do we actually measure those impacts? And it also really needs interdisciplinarity, because it needs technical backgrounds. It also needs backgrounds in social sciences, for example, and for people who also understand these healthcare contexts. And last but not least, this requires really strong partnerships, international partnerships that also work equitable with each other, so that everybody has a benefit. So at the end, if we want to apply this to deploying AI in global health research, I think this is not just an investment into global health from the German side, but it's also an investment and innovation strategy.
Wonderful. I think there was an important point you raised when it comes to healthcare specifically, the gap and the risk that follows from any deficiencies in using AI for people's healthcare. They just have such significant consequences. It just makes it far more difficult than if it were being used for other things, like in the social sciences, for example. And you raised an important point, another important point, which was about partnerships. With AI and technology in general, there's a competition, and there's also a need for cooperation. And then there's this key term called coopetition, where you want to be competing, but you know that there's some benefit in also holding hands and sharing data and finding the right balance there for healthcare, considering privacy regulations becomes difficult across borders when it comes to global healthcare. So that's also an important point. Thank you. So I think now we can open up the discussion to the audience. May I please ask, in the interest of time, so that we can have more questions, that you keep your questions brief and direct so that we can have more voices join the conversation. Please, if you have any question, raise your hand. We'll get a microphone to you. You can introduce yourself and address your question to a panelist or to the entire panel, and whoever feels comfortable will answer it.
Yes, hi, thank you so much. Pedro Villarreal from the German Institute for International Security Affairs. And one cross-cutting issue that I'd identified, and I would ask you to elaborate a bit more upon, speaking about the need for international partnerships, so how to deal with this tension, or rather the challenge of, let's say, a normative divergence between different countries and between societies on, for instance, the role of data protection, right? I think Bernd Fiedler also touched upon this. In some countries, data protection is not even in the top 5 or top 10 of priority issues that they're worried about. So how, from a German perspective, right, standing from Germany, how to engage in these international partnerships, acknowledging this normative divergence of what societies value more when it comes to the use of AI in the healthcare setting. Thank you.
Well, one of the ideas of AI is not only making it more complicated or more but also cheaper and faster to implement technology. for example, we're building big scanners, and with AI-powered, we're trying to bring the cost per scan down because you need less voltage to run your systems. You have maybe not so clear pictures from the beginning, but the AI is helping to clear out the fuzz, so you can scan faster or with lower voltage to have the same results, and which also makes the systems smaller and cheaper to implement in other countries. Like this is part of our Elevate Health Globally strategy.
Wanted to add another dimension. So I mean, it's not working? No. Okay, so I hear my voice really well. I thought it's you are in the same boat. So the sort of I mean, you mentioned about the data issues. So even in some countries, when there is a sort of, let's say, market entry regulation for devices, in many middle-income countries, that doesn't still include the AI assessment of it. So they assess a device, but they don't look at the AI part of it as part of the process. So it has not been yet, the methodology has been well advanced. And that challenge, on the other hand, is also a big challenge. I mean, the need for the update and the processes, but how that update is working, how going forward, that's also a major issue. Then the other thing that, I mean, many devices now do, they actually help the sort of the decision. They summarize it. Part of the fasting is not fasting reading, but also fast writing of the report as well. So they generate the first report. And sort of, we know in many, especially in, so let's say European countries, has been a challenge of not having enough radiologists. But now, I mean, they generate the report for you. And so if those back-end part is also not well assessed, I mean, the test center, as you mentioned, the concept of sandboxing, sort of environment, all those things, if they are not well employed, then there are the other dimensions we need to look at. But knowing at the same time, AI has a lifespan which is very short, and none of the existing regulatory mechanisms are up to that life cycle, which is, again, a big challenge for you. Want it, and you want it to be good, we need to find new ways, and we need to find that really fast and apply it.
Yes, there is always a challenge with doing things well and doing it quickly and doing it with the lowest amount of cost. So, yes, please go ahead.
Julia Fitzner from WHO, from the Pandemic Hub here in Berlin. No, thanks for the perspectives. I think, and I want to sort of go a little bit further in AI for global health, because I think a lot of times we talk about AI for healthcare and how we export it and how we use it in all countries, which is a global problem. But I think when I think of AI in global health, it actually means more, not actually the AI that we use for patient care, but how do we bring it together for the overall global decision? So how do we bring together data, sometimes the systematic data, for example. There's so much system data in the systems that the health machines are now creating, all the lab data, which is stored in clouds, which is not used. And it could, and there's no this GPR, the problems that we have are, we don't go there yet. And I don't really understand why we don't tackle that also in this context of the discussion, how we bring together the data that is existing and is more easily existing than it doesn't have the privacy things. Yes, we need to train them. We need to train them in a lot of different things. It's proprietary problem, but we don't get there at all. And I think in the AI for global health, AI discussion, we need to bring those needs more forward as well. I think a lot of countries will tackle the problem with AI, and it's a problem, and I absolutely agree, and I think it's a great discussion. But I think we need to also take these kind of other areas of AI in the global health spectrum, and maybe you have some ideas on that as well. Thanks.
Any of you would like to? And then I'll come to you, Jana.
Yeah, I can also do it very quickly. So yeah, I absolutely agree with your point. I think there is so much potential also to leverage AI on these huge data sets that you were describing that are floating around there. And I really think we should also think about how we can employ this really for the goal of understanding diseases better and how we can how they result in different people and how we can manage them on a global scale. Absolutely.
Dr. Rashidian, please.
I mean, so for example, one case, and many thanks, Julia, for raising that. So one case is, for example, for detection of diseases, pandemic, etc. So, and for that, again, I mean, sort of AI being used, WHO has deployed, I mean, Berlin Hub has deployed certain really good AI tools for that purpose. What we need also to bear in mind, again, sort of the way that these systems are working, what source they rely on. So let's say if you have something that at the global level can help you to identify a new threat more quickly, does it help you also at the national level to supervise those processes? And that level is not necessarily the same thing, given that the culture of how the news is spreading in the countries differs widely from one to the other. What's resources, how it comes forward. And that's, again, another level. So, I mean, something that is a global good, how to make it also something that responds to the country's need at the same time. The other element of it, as I said, I mean, and you refer to global health decisions, is about, okay, you find a threat, what to do with it? So what the evidence is telling you. And that challenge has become bigger as well. I mean, I'm saying that as a joke, but as a real joke. Many here are from academia. You sometimes, there is a worry about who writes the paper. So when the journals receive it, but then you've written your paper, you send it to review, and then you read the review and think probably the review was written by AI. So in a way, we have actually a reproduction of thinking which is not original anymore. There are benefits there, but who is supervising this? Who is critically appraising this? And what would be the impact of such approach in the long run on making better decisions? I think that's very critical to think about.
78% of us, when asked, like, how could the data of the photo of the AI dermatologist be used, said, yes, use it, but anonymized, which doesn't give the back channel to reuse the data to mitigate risks, personal risks. We are having right now a project with Melinda and Bill Gates Foundation. There are testings that are done with becoming mothers anyway, and we are reusing the data to mitigate other healthcare risks. I'm not a laboratory expert, so I cannot go deep into that, but you can look it up. So yes, you can actually reuse data, and it would be to our great benefit because AI is making us see things that were hidden in plain sight just before.
Yeah, and I think there's two things to mention. I have to consistently remind myself that when it comes to global health, there's the health aspect of it, which makes using AI difficult because you're dealing with patient data. And when we talk about global health, now you also have to consider the fact that you've got so many different countries that practice health differently, offer services differently, and their capacity and resources are different as well. May I please ask that you keep your questions so that we can stay on track with time? We have a representative from the Ministry of Health, and I want to make sure that we are going to be on time for the next part. I am going to finish with what we call a lightning round. So 3 keywords, if you may. Please share with us. If you had to sum up, and this goes to all 4 of you, if you had to sum up AI in healthcare 10 years from now in just 3 words, what would they be? Whoever wants to start, please go ahead.
So I would hope for evidence-based, responsible, and empowering.
Very good.
I'm going to try to not repeat. I would hope for strong partnerships. Is this on?
Yes.
It's on. Expansion, that we progress, and accountability that's meaningful, or accountability with teeth, but not too heavy.
Implementation-wise, I would go with trustworthy, bold, hopefully made by Siemens Healthineers.
Yep. I mean, I would highlight sort of equity aspect, accountability. But the other thing I would highlight, and it's part of the future AI framework that you also the traceability, especially when it comes to evidence-based decision-making, is mainly about traceability. Where it comes, how it was critically appraised. Can you repeat it again? And AI is not doing that at the moment, and that's really important for the next 10 years.
Thank you to all of you. There are some themes that keep coming up. I don't know if you've recognized trustworthy, accountability, equity, responsible use, and they're all very important. I'd like to say I really appreciate all your insights And if you would please help me thank them all.